Sween 24 cream is used to moisturize and treat dry, rough, scaly, itchy skin and minor skin irritations like diaper rash and skin burns from radiation therapy. It contains emollients that soften and moisturize the skin, reduce itching, and flaking. Some products in Sween 24 cream, such as zinc oxide and white petrolatum, are used to protect the skin against irritation from wetness. Dry skin is caused by a loss of water in the upper layer of the skin, and emollients/moisturizers in Sween 24 cream work by forming an oily layer on the top of the skin that traps water in the skin. Common emollients in Sween 24 cream include petrolatum, lanolin, mineral oil, and dimethicone. Humectants like glycerin, lecithin, and propylene glycol draw water into the outer layer of the skin. The cream also contains ingredients that soften the top layer of skin cells and help the dead skin cells fall off, retain more water, and leave the skin feeling smoother and softer. When using Sween 24 cream, make sure to follow the directions on the product package. Some products may need to be shaken before use, so be sure to check the label. Apply the cream to the affected areas of the skin as needed or as directed by your doctor. If using it for dry hands, you may need to apply it every time you wash your hands throughout the day. If using it for diaper rash, be sure to clean and dry the area before applying the cream. And if using it for radiation skin burns, check with your healthcare provider first. Remember to only apply the cream to the skin and avoid sensitive areas unless directed otherwise. Use the medication regularly for the best results and consult your doctor if your condition doesn't improve or gets worse. Most emollients can be used safely and effectively with no side effects. However, burning, stinging, redness, or irritation may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If your doctor has prescribed this medication, remember that your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including unusual changes in the skin, such as turning white/soft/soggy from too much wetness, signs of skin infection. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before using Sween 24 cream, let your doctor or pharmacist know if you are allergic to any of the ingredients in the cream or if you have any other allergies. This cream may contain inactive ingredients that can cause allergic reactions. If you have skin cuts, infections, or sores, consult your doctor or pharmacist before using this product. Some ingredients in the cream may make you more sensitive to the sun, so be sure to check the label for any warnings. Your doctor or pharmacist may suggest that you limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If your skin is prone to acne breakouts, look for the word non-comedogenic on the label. Before having surgery, inform your doctor or dentist about all the products you use. If you are pregnant or breastfeeding, consult your doctor before using this product. It's important to be aware of potential drug interactions with Sween 24 cream, as they could affect how your other medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If Sween 24 cream is swallowed, it can be harmful. If someone takes too much and has severe symptoms like passing out or difficulty breathing, they should call 911. Otherwise, they should contact a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222, and Canada residents can call a provincial poison control center. When it comes to preventing dry skin, there are a few tips you can follow. Use lukewarm water, not hot, when bathing and try to bathe less often, like every 1 to 2 days. Keep your baths/showers short and consider using a humidifier if the air is dry. There are different types of emollient products out there, like oils, creams, lotions, or sprays. Some may contain fragrance or other ingredients that could cause sensitivity. It's best to talk to your doctor or pharmacist to find the right product for you. If you're using Sween 24 cream regularly and you forget a dose, just use it as soon as you remember. Don't use extra or use it more often than directed to make up for it. Make sure to check the storage information on the package, and if you have any questions, ask your pharmacist. Keep all medications away from children and pets. Do not store the foam canister near high heat or open flame, as it is under pressure. Do not puncture or burn the canister. Do not flush medications down the toilet or pour them into a drain unless instructed. Properly discard the product and it is expired or no longer needed. Consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.